Welcome, everybody. We're just going to give it a few more minutes to let people come into the room here. Welcome, everybody. Welcome. Good afternoon, good evening from across Canada. And thank you for taking the time to be part of this historic evening. So my name is Dr. Atos Sechi Otu. I practice orthopedic surgery out in Brampton. My co-chair of the Health Working Group is Dr. Bukola Salami out in Calgary. And so on behalf of the co-chairs of the Health Working Group, on behalf of our CEO, Craig Wellington, on behalf of the entire organizing committee of this town hall series, and really on behalf of the Black Opportunity Fund board, we'd like to thank everyone for taking the time to be part of this town hall series, trying to improve the health outcomes in Black communities across Canada. So I'd like to start with a land acknowledgement. So we are meeting today on the traditional territories of many Indigenous people across Canada, and we all acknowledge their roles in taking care of these lands. I'm personally meeting on the lands that constitute the present-day city of Mississauga as part of the treaty and traditional territory of the Mississaugas of the Credit First Nation, the Haudenosaunee Confederacy, the Wendat, and the Wendat nations. We're all grateful to work on this land and similar territories across Canada. Many of us are also ancestors of stolen people who were brought to a stolen land, and we also wish to acknowledge our own Black ancestry, a history of Black peoples across the diaspora, an ancestry that recognizes the struggles and survival while honoring our own narrative of pursuing self-determination. And so we continue to stand in solidarity with Indigenous peoples to eliminate racism and the effects of colonialism on Turtle Island in all its forms. Next slide, please. So why are we here? We know that Black people across Canada are disproportionately affected by many diseases, whether it be COVID, hypertension, diabetes, access to cancer care, cancer surgery, and other conditions. And yet there's no national strategy, comprehensive strategy to improve the health of Black people in Canada. We thought that there's a need for a sustainable strategy to address the health of Black people in Canada by engaging Black communities towards developing a national strategy. Next slide, please. And so in session one back in March, we looked at the priorities of Black health services and policies. What are the barriers? What are the issues? What are the gaps? And we recruited some of the experts across the nation, Dr. Sena, Dr. Salami, of course, Dr. Edward Kwasi, Valerie Casimir, who is a nurse with the Haitian Nurses Association in Montreal. In session two, titled Models of Success, we looked at best practices, what's been working well across Canada over the years in different pockets. We recruited the Walnut Foundation, Taibu, Health Association of African Canadians, Ruth's House in Calgary, and we also looked at the organizers that recently developed Peel Black Health and Social Services Hub. Next slide, please. And so today's session is titled Capitalizing on Black People's Strengths, Black Health Leaders, and Health Professionals to Improve Health Service Delivery. So our objectives today are to bring to light the current strengths and capacities within the Black community, to discuss activities and roles of Black health leaders and professional organizations and other resources within the Black community, and also discuss how these strengths can be leveraged to better support Black people's health and issues identified in our previous sessions. Next slide, please. Just a little bit of housekeeping. First and foremost, I'd like to acknowledge our sponsor, Canadian Race Relations Foundation. But we are recording this session. You have the option of listening and dialoguing in both French and English. There's a bottom icon. There is a Q&A chat room. We are trying something a little bit different. We don't have breakout rooms today. We're going to be using the Mentimeter software so that we have an interactive discussion with some of the leaders and panelists today. Sometime in the future, you will be getting a post-event survey. So please look at this and fill it out. We welcome your opportunity to get some feedback. And we're sure not going to be able to answer all the questions, but we do have an email that you can dialogue with us in the future, bofhealth@blackopportunityfund.org. Next slide. So just a bit of a disclaimer. I'm a huge fan of Dr. Anya Norum. She's a mother. She's a physician. She's an advocate. She's a public speaker. She's a social warrior. She's a leader in the field of public health and equity. I've learned a lot from her personally. We don't have enough time, enough slides to fill out her credentials, but she is a co-founder of the Black Health Education Collaborative. She hosts Health Caring Differently, and you can find her almost anywhere on the internet. Just look her up: Instagram, LinkedIn, Twitter, TikTok. She has her own website. With that, I'm going to hand the mic over to Dr. O.
Thank you, Atto. Thank you so much. Good evening, everyone. Oh, this is such a wonderful opportunity. Thank you for asking me to moderate this evening's event. We've got really phenomenal panelists who are going to be presenting as we try to imagine and create a new future around Black health. And so that's been the focus of my own career as a public health physician and working in primary care as well, but working with community and seeing how we can imagine and implement other ways of supporting and improving our health. So for you tonight, we've got some wonderful panelists, and I'm going to be introducing them. Now, because they've put this slide here with some of a little bit of my background, but in fact, every panelist tonight, their bio is like, hey, oh my goodness, just dripping with Black excellence. But we want to have time for getting feedback from you and for us to have discussion. So the way I'm going to introduce each panelist is really just to read out their name and their organization. But I encourage you, I challenge you, I implore you to please go to the Black Opportunity Fund website for this event and read their full bios because it's fire. But as it so happens, I can only just read because we're going to be tight on time and want to hear from them as opposed to hearing about them. I'm just going to read their names and their organizations. After that, we're going to have their panel, the panel present. So I'll talk about the questions that we'll cover, and then we're going to have a Q&A, and we're going to speak with you. We're going to do a bit of Mentimeter. We're going to do a little fancy stuff, but we want to hear from all of you. So without further ado, let me introduce our panelists. So first, we have Dr. Nicolas Cadet, who is an oculoplastic surgeon working at the CIUSSS du Centre, so coming to us from Québec. Alors, bonsoir à tous nos amis francophones. Je sais que vous avez un peu d'interprétation disponible pour vous, mais je voulais encore juste dire moi-même, vous dire bonsoir. Nous sommes excités pour ce nuit-là. All right, then after that, we've got Dr. Dolores Mullings, who's professor of social work and the inaugural vice provost of equity, diversity, and inclusion and anti-racism at Memorial University of Newfoundland, so coming to us from Newfoundland. Then we have Dr. Mojola Amole. So Dr. Mojola is a breast surgical oncologist and general surgeon. And of course, near and dear to my heart because she is the president of the Black Physicians Association of Ontario. And then next up, we've got Noreen Sabanda, who is the executive director of the Alberta Black Therapist Network, as well as the co-founder. So very much needed, and we're excited to have her with us. With her also, we've got Dairai Kapfunde. And so Dairai is a registered clinical social worker and approved clinical supervisor within the Alberta Black Therapist Network. And then last but not least, we've got Damilola Iduye. So Damilola is the co-founder of the Pan-Canadian Nurses of African Descent. So we're excited to have Damilola with us as well. All right. So I think we're going to now transition to the panel presentations. But really, I want to kind of center us. So we need to anchor on something. We have presentations from all of these great leaders tonight, but there are two key questions that we're focusing on this evening. And so the questions for this session of the three, so this is number 3 of 3, is really what potential exists within Black community to improve Black health? Okay, so that was the first thing that our panelists have been asked to speak about. And also, what role can Black organizations play, or are they playing in improving the health of Black people? So today is about our strengths, it's about our opportunities. We have to talk about the challenges, but it really is going to be focused on reimagining a future for us. So we're going to go in the order that people are listed on the website. So that's the way people are going to be asked to come and present. So first on the list is Dr. Nicolas Cadet, young oculoplastic surgeon. Please go ahead. Bienvenue.
Merci beaucoup. Merci beaucoup à vous tous. Et donc, c'est un plaisir d'être avec vous ce soir. Je vous avoue, je suis en train de chercher ma présentation. Est-ce que vous voyez mon écran? Can you see my slides?
Oui, absolument. Absolutely.
Great. And so I just wanted to spend some time and present some of the things that we're working on in Quebec. I have to say that that I'm very proud, you know, to collaborate with some amazing people in Quebec. We have our Nurses Association, including the Haitian Nurse Association, the Haitian Physician Association. I guess you will have kind of guessed that I am of Haitian descent. And it's really good to see people across our, you know, our community of African descent coming together to work on some nice projects together. And I can really see that since the past few years, there have been some very nice initiatives. And I really want to thank each and every one of you, everyone from the Black Opportunity Fund, for being catalysts in that change and in people coming together. So that to me, in fact, is partly answering the question. I think, you know, what are some of the strengths that we're seeing? Well, it's really people coming together. So people from our communities coming together, some people who didn't know each other, coming and working together. And so I'll just show a few slides of some projects we're working on. This is a project we're working on the South Shore of Montreal. Donc, c'est la clinique de médecine familiale de ma mère sur la rive sud de Montréal. Notre but, c'est de non seulement la maintenir en vie, mais aussi de la revitaliser puis de permettre qu'elle puisse déménager dans un plus grand édifice. You know, for us, it is special to have Black entrepreneurs being a part of a project in a non-Black majority neighborhood. I do think it sends a strong message that we're, you know, that we're dynamic, that we're present, and that we bring back to our communities, certainly of African descent, but also to other communities as well, so that we're, you know, that we're contributing to society as a whole. These are some pictures of what we want to build very soon there. This is what the Cadet Foundation, my family foundation, is working on in Haiti. So it's a big project that many different groups are working on there. And once again, it's an example of people from the diaspora and people in Haiti coming together for a significant project. So you can see some pictures. Those are pictures of the school. And we personally are working on basically a community health center that's going to be focusing on ocular health. Of course, it had to be about the eyes, being an ophthalmologist, but also on mother-child health. And so that's a project we're really passionate about. It's in the north of Haiti, close to Cap Haitien. And one of our dreams would be to accomplish a project in Montreal North. So I'm just showing here a medical complex that we would like, a future clinic to basically be there, because we know that that's one of our neighborhoods that has significant needs. And so we are working hard with people from the community, from different, I would say, from not only physicians or nurses, but people across across all of our healthcare workers coming together to collaborate with this, and also with other community leaders. And I would finish by saying that, so I will stop my screen sharing, just to say that one of the things also that we find that is crucial for the progress of our Black communities is really to invest in the next generation. And so one of the things that at the Cadet Foundation we're doing is that we have partnered up with McGill University to help support young Black medical students. And so since we got on board, we cannot take credit for that. It was really the work of a lot of people from the university and other leaders, but the number of Black medical students at McGill has gone from a maximum of 4 per year to over 20 for the past 3 years. And so we're really glad about that. And you can imagine that over the years, if that continues, well, we're going to have a really nice network of Black medical students who will become residents, who will then become physicians, and who will give back so much to the community. So on that note, I want to salute all of my colleagues, all the panelists who are doing amazing things, and to just say, let's continue doing everything we can together to help boost our communities. Let's invest in the next generation. Let's do it.
Oh, bravo, bravo. Thank you for that. It's so it's ironic for me. You're such a young man saying for the next generation, but you've accomplished so much. So I think it's amazing that as you lift, as you climb, you're lifting, and part of such a wonderful initiative, or initiatives, I should say, in Canada and also in Haiti and beyond. Now I'm just thinking, because I grew up in Montreal, so I know what that means, Montréal Nord, but do you want to speak about the vision for the community health center? Like, what is the demographics? And in particular, we're thinking about Black populations today, but of course we want to be broader because it's racialized as well. So do you want to just give a little bit of clarity on what what population that community health center will be serving?
Yes, absolutely. So in fact, we know that Montreal North is really quite multicultural. There is certainly like a significant proportion of the community that is of Haitian heritage or of African descent in general in Montreal North. And so we felt that there are so many healthcare workers from our communities of African descent in Montreal and in Quebec, but oftentimes we're quite scattered and working in different hospitals and clinics and whatnot. But we would like to have a bigger project that brings all of us together in a kind of for us, by us fashion. So, we have a lot of respect for what the community has done, for example, in Taibu, in the GTA, and other similar projects. So we feel that is the type of project, in a for us, by us fashion that we think would really benefit the community. And so definitely, I think it would be targeted to our community, but also, taking into consideration the whole multicultural scene, in Montreal North, where there are very significant health needs. And also we can see that the social determinants of health are really at work. There are significant financial disparities and challenges in the neighborhood. So we feel that, it could bring a significant difference. Yeah.
Okay, well, thank you. So we're going to go on to the next panelist, but we're going to hear from you in the discussion. But overall, I think it's wonderful that you and your family are involved in work that speaks to the general population and making an impact as Black leaders there. But then also the vision for the community health center around local Black and racialized folks, doing that global work in Haiti, and then also providing support for the future Black physicians of Montreal, of Quebec. So really, you've kind of got the whole spectrum. So again, congratulations, and we look forward to the discussion with you a little bit later on. Merci. All right, now, so we were out in Quebec. Now we're going to head over to the region out east. So we're thinking about Newfoundland, and next up is Dr. Dolores Mulling.
Hi, good evening, everyone. Thank you, Dr. O. I'm really happy to be a part of this panel. I come from a social work background, so I will be sharing a piece of what that might look like. But of course, what I'm going to share can be generalized to health for Black people. And, the research shows that when you center race in anything, you actually cast a wide net, and you don't have to worry about catching this group or that group, because you actually catch everybody when you centralize race. So this centralizes Black people. This idea I'm going to speak about centralizes Black people, but because it's focused on race, it actually catches everybody. So I'm going to briefly then really talk about a principle of Afrocentric social work, which I said can be generalized to any health and service industry. And so I focus specifically on this particular model that was developed by Dr. Wanda Bernard Thomas.
Sorry, Dolores, I just want to check something so that we see you well. Are you doing a PowerPoint slide or speaking? Okay, then we can pin you so that you come up big so we see you in a big way, okay? That's why I'm asking. Okay, so I'll speak to keep going, but we'll see how we can get you amplified. Okay.
Thank you. Yeah, so this, really the epitome of Black leadership, this model of practice modality was developed by Dr. Wanda Bernard Thomas and Dr. David S., who neither of them, needs no introduction, but particularly Dr. Wanda Bernard Thomas. And this speaks to centering Afrocentricity in everything that we do around providing care or services to Black people. So, my grandmother would say from Hayai, which means from when she was a small child, she had seen, I was born and raised in Jamaica, but she'd seen how the foundation of Afrocentricity, formed what life would be like for, people in our neighborhood or community. We weren't so formal in saying Afrocentricity, but I know that's what we were practicing at the time. But, and some of these principles, speaks to, in Sankofa, for example, ensuring that, we bring everybody with us, not leaving anybody behind, kind of thing. But this particular framework has 6 models, and I'll be quick because I know I only have 5 minutes. 6 principles to this model. And it speaks specifically to how racial cultural shifts can disrupt, the kind of experiences that, Otto spoke about, and disrupt how white supremacists and patriarchal colonial perspective show up in healthcare and healthcare services for people of African descent. And so principle 1 sees the individual problem historically and rooted in family, community, and social structure. So basically that means in theoretical interpretation for that really challenges are seen as a structural in nature rather than caused by individual deficit, which is how we look at healthcare, providing care for people. We look at what the people are not doing while they're sick, and then we try to fix that. But this model suggests that you actually look at what the structure, what's happening within the structure. Principle 2 speaks about raising individual and collective consciousness. And so, you know, you've done that with the first 2 town halls, and each one of us here are doing that kind of work on a daily basis. But, you know, basically what this says is you raise the consciousness in a very direct and distinct manner, and ensuring that members of the African communities, wherever they are, whatever region, however they come, whatever shape, size, sexual orientation, gender identity they are, that their collective consciousness is raised. It also includes helping people of African descent gain knowledge and understanding of their histories and contributions to the world. Quite often, we only see and hear anything about us during Black History and Liberation Month, and not even our accomplishments are seen. So we suggest raising our own consciousness. Principle 3 recognize a collective consciousness. So again, you can see the slant to collectivity as opposed to individualism. This is what recognizing and centering, celebrating and honoring Black lives and the contributions and accomplishments of different cultural, regional, and geographic experiences of people of African descent. You know, so it's really around, again, recognizing a collective consciousness that regardless of where we are from and where we're located right now, we're not a one-dimensional project. We should not be essentializing our people as a monolith, and we need to just be mindful of that. Principle 4 speaks to critically analyzing the intersecting nature and lived reality of oppression. I don't really like that word oppression, but that's what we settled on. And so, you know, regardless of what's happening, we need to recognize that encompassing this intersectionality of social identities and factors such as our race, as I said before, gender identity, language, ethnicity, health status, ability, wherever we live, so regional pieces or age, class, ability, those all need to be taken into consideration at the same time. Might be tricky because that's not how we're used to doing things, but if we want to make a difference, we actually need to consider the whole person in all that they come with rather than pieces of them. And, you know, people who are receiving healthcare, including all of us, will tell all of us that they cannot, you know, we can't treat a part of us or a little part of this part. We have to treat the whole person. Principle number 5 is to help to empower both individual and collective, the individual and the collective, and to build strengths. And so how that is, this theoretical interpretation basically suggests that we recognize people of African descent have inherent strengths and resilience. And I don't mean toxic resiliency, where we say, you know, we're being harmed and we say, oh, that everything is fine. But, you know, to understand that, you know, this resilience and strength is rooted in African values and traditions. And this builds on existing strengths to promote empowerment, growth, development, self-determination, and all those things that are important in when people are being cared for. And then the final one is principle 6, which is seek social change and social transformation. And this is where we need other people to actually support, you know, whatever it is we're trying to do. The other pieces, we're focusing on ourselves, but we know nothing happens in a vacuum. So we're actually looking for others as well as ourselves to actively participate in dismantling the anti-Black, racist, white supremacist, capitalistic, patriarchal systems and structures of domination, to end the historical project of colonization, and also to promote Black liberation. And so we know that without Black liberation in its entirety, it doesn't matter really what we do, we're still fighting, you know, trying to go upstream, right? And so the final piece I just want to leave you with is that it takes a lot of Black leadership to bring us to where we are now. It'll take that and more to bring us forward to where we want to be. And we also need people who call themselves allies, or people who we define as allies, and really accomplices to help us realize these dreams and goals. Thank you.
Oh, wow. Dr. Dolores, thank you so much. Dr. Mullings, I should say, Dr. Mullings, thank you so much for that. And I think, actually, I just had a question because I'm thinking what we need is to be able to kind of be able to refer to this in real time. The framework, this phenomenal framework, is there a link that we can put in the chat like right now for folks to view it? Is that possible, or will that be in the future?
It's in the book that I mentioned. It's in the book.
Yes.
The framework is published
Okay.
in the book, Afrocentric Social Work.
Okay.
I meant to mention that. I can drop. I'm not trying to advocate that we should buy the book, but that's where the
No, you have to tell us where this is sourcing it. No.
Yeah.
Family. Yes.
Yeah.
So let us know as family where we can, because what you're doing is you're giving us the a prescription for our community wellness. And I love that you talked about we tend to focus on health. So you can go ahead and drop that in the chat if you like, or you can send it to Nia, or we'll put it out after. But I think at its essence, you mentioned at the beginning, we focus on what's gone wrong. And that's the essence of Western medicine. And I say this as a physician of Western medicine, but in Western medicine, it's about pathogenesis, right? Focusing on how things go wrong, dissect it, try to fix that thing, right? But really, if we're talking about health and wellness, then we should be focused on what's called salutogenesis, right? Not how things go wrong. How do they go right? How is health created? And from an African lens, the framework that you provided, these 6 principles, are a phenomenal way for us to use that framework and go forward with it in our organization. So I thank you for this gift that you provided to us today. I'm going to quickly summarize it. Interrupt me completely if I get something wrong, but I tried to I'm just summarizing because of course it's a whole book. But number one is having that critical awareness about the structures that have created our issues. Number 2, individual and collective consciousness, right? We have to be the certain groups are misusing the word woke, but we must be awake. We must have that consciousness to know who we are, so we can, and where we've been and where we're going, recognizing that we're not a monolith and not acting like we're one community. We're facing the oppression, but we have our diversity and our beauty and our different ways of being as we come together. Number 4, understanding our intersectionality and the different factors that create power and privilege in different ways for us in different settings, and the role of oppression in that. Number 5, working on building our strength, again, thinking about that salutogenesis. And then number 6, thinking about that social transformation. And I was doing this when you were like the patriarchy, the colonization, the capitalism, all of those factors, we have to understand them and we have to be able to address them in order to move towards Black liberation. Did I get that right?
Absolutely. Great job.
Thank you, Dr. Mullings. Okay, so we're going to look forward to hearing more from you and your wisdom as we go into the second half, where there will be a Q&A. Okay, but thank you for that presentation. And let me check in the chat. Do we have the link, or we'll have it a little bit later on? Okay, so we've shared the link to the framework. Excellent. Okay, so next, we had Dr. Omole scheduled next, but she's a surgeon, and I think that she's a little bit occupied at the moment. So we're actually going to just, as we do as our people, we just kind of flex and be flexible and fluid. So we're going to actually jump over her and give her a moment. She might need to clear out of the operating room. And we're going to go to Noreen Sabanda, who will be presenting on behalf of herself and Dairai. So please go ahead with your presentation.
Hello, good evening, good afternoon, everyone. I am going to be sharing our slides. I'm just waiting on Dairai to come on.
I am on. Noreen.
Okay, I see you. Perfect. And it's only fitting that we follow Dr. Mullings, right? That we are going to be centering. So bear with us. And part of that is we wanted to put everything into context, because anytime we talk about mental health, it always feels like, whoa, 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 we've gone into a different space. So we wanted to center and bring everyone into the same space before we talk about what are the strengths and what we're doing within our space. So this has already been touched on, which was great. Dr. Mullings highlighted the importance of not only looking at what's wrong with the individual, but looking at the structural factors that affect health, right? We cannot just simply look at health if we're not looking at income. When we're looking at education levels, we're not looking at race, we're not looking at gender. All of these play a role, especially for racialized individuals. So this was really important for us to highlight and center everyone into that. And so,
Sorry, Noreen.
Yeah.
We're not seeing the slides. We're seeing we're not seeing the slideshow. We're just seeing
oh,
the
We can see the
PowerPoint.
slides, but you need to click, full slideshow. So
so
we were
I
able to see it, but we couldn't see the
let me
full.
make it full
slide.
slideshow before I share,
Mhm.
because when I share, it might lose it.
Okay, let's try that.
What about now?
It's loading. It's loading. I suspect we will be able to see it well, but it's still loading. Hopefully it'll show soon. It says we are viewing your screen, but it's just telling us loading.
How's that?
No, it's still showing just the PowerPoint itself. Are you able? Yeah. Can you click slideshow again?
Yeah,
Click it now.
I do.
Oh dear, no.
Why don't I share my screen? We have the same PowerPoint.
Perfect. Yeah,
Okay.
teamwork. Okay.
Okay, can we see the screen? Noreen, can you
Yes,
see this?
indeed.
Yes.
Yes. The power of teamwork. You're good. Okay.
Okay, and this is the part that you were just talking about, Noreen. Okay. All right. So I like that we are presenting right after Dr. Mullings, because it's so befitting, and we take everything that she said and just encourage you to think of Black mental health within that context. We say that race is a social construct that then imposes homogeneity, and which then erases, minimizes our identity, our experiences, and literally even just how mental wellness or illness of racialized as Black individuals and communities in Canada looks like. Then this also then impacts our access to the services, the outcomes that we get. So Black mental health has to recognize the influence of racism, colonial oppressive structures that continue to reproduce and perpetuate those inequities by refusing to acknowledge the unique differences in the racialized as Black communities. And so to think more in terms of it encompassing identity-based trauma, which pretty much most of us, or all of us, are navigating on a day-to-day basis, and it impacts our overall well-being. So it has to recognize the impact of intersectionality and the daily navigation of systems of oppression. So Noreen, there are some mentions that the community did about what Black mental health is to them. Perhaps you could share that.
Yeah. So when we engage with the community and ask, what does Black mental health look like for you? And some of the ways that it's been conceptualized is the recognition of the cultural, spiritual ways of knowing and healing. Black mental health means Black wellness, Black success, breaking generational curses, and increasing wealth. being okay with mental health on a spectrum. So being unhappy, confused, unable to perform tasks, but also allowing for the happy side to also exist at the same time, right? It means destigmatizing, empowering, hope, enriching all individuals who identify as part of the Black community, an appreciation of cultural struggles, achievement, celebration, recognition, and respect. It also means Blacks suffer from mental health, but they're not a one-size-fits-all approach to how we engage with them as well.
Awesome.
Yeah. So when we look at Black mental health today, with what we know, the studies that are out there, we're hearing that 38.3% of the Black Canadian residents who report poor or fair mental health rarely utilize services. So compared to 50.8% of white Canadian residents. So we're still seeing a discrepancy, even with an understanding of what Black mental health is, the access to services is still different. And out of 328 Black Canadians surveyed, 60% say they'll be more willing to access mental health supports if the mental health professionals were Black. So speaking to the need of representation when it comes to that. But we can also touch as to why some of those discrepancies continue. And that's on the next slide, Daira.
Yes. So it's only befitting to just talk a little bit about the history of Black mental health, since we're talking about what it looks like today. And I will reiterate again that I am so happy that we got to, present right after Dr. Mullings, because everything that she said laid the foundation of what we're actually doing and talking about right now. So we know that the health system is aligned with the powers in place, so all operating basically in a colonial framework that was not designed for us, and it was designed by people that did not originally look at us or just consider us or regard us as human. So the misdiagnosis of Black people when we're talking about the DSM, so DSM again, paranoia, we've got drapetomania, where Black people were attempted to flee plantations, were then diagnosed as having that, and medical abuse, violence, where again there was mistreatment, diseases that were introduced without us without us knowing what was going on, minimizing and disregarding our mental well-being and pretty much our overall well-being. So there are disparities in healthcare outcomes, and these also were previously. So where we are at today is as a result of what was planted historically, and we're just seeing the consequences of what was done before. So you see lower quality of care, higher rates of certain chronic conditions. Noreen, could you speak to the stigmas?
Yeah, and so when we look at the systems and structures in place, those have an impact on the individual. And so on an individual level, we come to have certain things that we say in the community, for instance, pray about it. So there's a reliance on community-based supports, such as churches, religions, or faith, whereas maybe professional supports could also be beneficial. And because of the stigma that's attached to, you are not supposed to seek out support, you seem weak, you are crazy for needing support, but also not understanding that mental health lays on a spectrum. That is, individuals can experience mental health concerns, but continue to function and continue to be able to hold different roles, parent, and be able to provide without necessarily deviating from society. And this also plays a role in the idea of don't share your dirty laundry within the outside world, right? So the past incidents of racism within the healthcare are also impacting how mental health supports are being received. And we can also see that playing out on who is actually prepared to offer the supports, right? So if there's no cultural competency, cultural humility, again, we're focusing on pathologizing individuals rather than recognizing the structures in place and what else is affecting them and allowing them to not thrive the way they would need to.
Yeah, and you and I were talking earlier also about parents sometimes not wanting their children to have a diagnosis or to actually acknowledge that there is mental illness going on or happening because one, your child is labeled, and when they're labeled, that label follows them throughout their lives, and then it ends up being an additional thing that is standing against them when it comes to, again, the intersectionality, when it comes to them navigating the system in their bodies. So some of the current challenges that we see and we speak to would be barriers associated with cost for mental health providers. For some of us who are in private practice, we're doing this is our job, this is our livelihood. So we have to then balance the making sure that you're keeping a roof over your head with making sure that you're also providing accessible services to our community. So we get insecurity from cultural influences, representation that Noreen just talked about, where we get, again, most of the people that provide mental health services do not look like us. And it's only now through Alberta Black Therapist Network that we're starting to gain awareness of the fact that there are people that look like us within our communities that can actually hold the space for people that are coming within from our communities and provide services. This self-stigma, so self-hatred, self-alienation, downplay of diagnosis or history of racism and the impact of racism on our mental health, consumer mentality, so over preoccupation with materialism and flesh sensation as ways of actually just coping and dealing with life, and then over diagnosis, where we have the criminalization of mental health and the overrepresentation, again, when it comes to the forensic aspect. Noreen, do you have anything to add?
No.
Sorry, just before you add, I have to be fair to, this is the bad part about being the moderator. I have to pull the
Yeah,
curtain sometimes, so I just want to let you know you're a little bit over time.
Yeah.
Oops.
Yeah.
Okay.
So in
Yeah.
the interest of time, we'll just jump to the last slide 9. So
9.
yeah, that's 10.
This is 10. Okay.
Previous
9.
one. Yes. So what are we doing? Knowing all of these different things is recognizing that mental health tends to be an afterthought in a lot of our partners' engagements within the community. We rely on partnering with existing organizations. As such, we're able to run mental health clinics with different organizations. We also work to increase the representation of Black clinicians. So we have a network of over 120 individuals that are therapists in Alberta. And we also have students and practicum students that we house in order for them to complete their training so that we can continue to grow the network. We also engage with the community through psychoeducation, workshops, circles, and training, just to bring not only the awareness, but also the understanding that mental health does not need to be something that people deal with in isolation or alone. This is something that can be part of our daily and ongoing conversation. And we normalize seeking supports. Dairai talked about people being in private practice, but also seeking supports that are culturally responsive and anti-oppressive and are more focused on healing and natural ways of healing and giving back to the community. Next slide. I think I can make it in 10 seconds. And so our next steps are to continue building our partnerships and collaborations, but also creating spaces for interdisciplinary relationships with other providers and other leaders as we are today, and finding ways to continue to inform policy and having conversations
Fantastic.
at all different levels. So yeah, we'll be here for the question.
So we have, first of all, congratulations on the phenomenal work you're doing. And we'll circle back for the questions. But I think the issue of Black mental health, even at a federal level, has been something that has really been recognized as an issue. And as you said, its roots for us, as far as our disproportionate representation, is because of colonization. So fantastic work that you folks are doing to disrupt that and to provide the much needed care in our community and creating that village. So we'll have more for you in the Q&A. So like I said, this is the thing about being moderator. I also have to do that push and pull because I want to make sure everybody has a chance to speak, but thank you. Okay, so next we have Damilola Iduye. Oh my goodness, Iduye. I should know that I'm Nigerian.
Right.
It took a minute. It's because my children's last name is Oduneye, so I'm like Iduye. All right, so Damilola, please take it away.
Thank you so much, Dr. O, and thank you to the Black Opportunity Fund team for the invitation to speak about what our organization has been doing and, in discussing on our strengths as Black people, as Black health professionals. So I'm gonna share my screen. Just give me a moment. And can you see my screen?
Indeed, yes, ma'am. Please
Okay,
go ahead.
perfect. All right, so that's great. I'm gonna try to make this really quick. I know it's a lot to kind of talk about in a few minutes. So yes, this afternoon or evening, depending on where folks are located across Canada, I'm gonna just pivot a little bit to talk about Black nurses in the Canadian healthcare system. So yes, we want to talk about strength. We want to talk about how to capitalize those strengths. But as a nurse and as a Black nurse, I think it's just fitting that I kind of pivot to talk about Black nurses. So just a little bit of background, like some numbers across Canada, and this statistics on this slide was from 2022. We know we have over 490, so almost 420,000 regulated nurses. But what we don't know is how many of these nurses are Black nurses. And I'm sure that everybody in this room knows why. We don't know how many Black nurses are in Canada. And that does have implication for education. It has implication for research. It has implication for everything we do. It has implication for, I think it was Dr. Mullins who used the term resilience, but not toxic resilience. And I really like that. How, if we don't know the number, how have we been represented in the Canadian literature? Until a few years ago when Jeffries et al., because this scoping review was done by a group of researchers, kind of looked at Black nurses in the nursing profession, and they wanted to know how Black nurses are represented and what evidence exists generally. And not surprisingly, there were less than 20 nursing research studies that have been conducted on Black nurses in Canada. And also like just a little bit above 10, just 13 that like non-research literature that had been published. So in total, over 30. That's not surprising because we know that Black people are not well represented in health research. Black people are not well represented in health professions generally. And in Canada, Black people were not admitted into the nursing profession until the 1940s, though the nursing program started over 50 years before that. So what is known about the experiences of Black nurses? And I'm sure this will resonate with so many folks in this room because we are mostly health professionals. One, our experiences as nurses mirror systemic and institutional racism and injustices that are not only present in the healthcare system itself, but also in education, in research, in leadership, in policy, in all domains of practice. And nurses also experience racism, not only within institutions or systemically, but also in interpersonal relationships, like among nurses, and structurally as well. And their experiences are shaped not only by that experience of racism itself, but also by other intersecting social factors, so like gender, like age, like citizenship and immigration status. And because of this experience and these experiences, we decided to do something in 2020. And when I say we, it's gonna make sense in a few slides. We all know what happened in 2020 with the, cruel murder of George Floyd and that awakening and reckoning of racism, not only in Canada, but all over the world, in the United States and the UK, and even African countries. People were really, really involved in talking about racism and that collective cry about the experiences of Black people globally, kind of, I would say, was a catalyst to where we are today as an organization in Canada. So one of the output of that collective awakening was a report by the Coalition of African, Caribbean, and Black Nurses in BC. They actually put an open letter and put together some recommendations that together, and this statement is not only referring to Black people, but everybody together, that we have the opportunity to once and for all create a culture of safety for everyone within healthcare system. And we are strategically positioned at this moment in history to make significant advancement in this area. And because of that, a group of nurses from across Canada came together to form an organization, and that organization is called the Pan-Canadian Association of Nurses of African Descent. And I'm sure many people have already heard about it. And simply is the national platform for uniting organizations supporting nurses of African descent, whether someone identifies as Black or African or Caribbean or Afro-Brazilian, all in that, anything in that of African descent category. And really, when we came together, we had two missions. First, we wanted to advocate for, ourselves as nurses. We wanted to amplify what we're doing across Canada. And we also wanted to advance the health and well-being of people of African descent. And at the end of the day, we really wanted our nurses to be inspired. We want them to be engaged. We want them to be empowered. And we want our nurses to occupy places of leadership and hold power in Canadian nursing. So in 20 years, we're not talking about lack of evidence on Black nurses in Canada, but we are actually in places of power where we change policies and change practices. So what is PCANAD? We, just like I said in the previous slide, it's a collective of different organizations. And on this slide, these are provinces where we have members or we have organizational members. And on this slide, you see some logos. So these are organizations that are already established. We have the Coalition in BC that I read a quote about them. The Canadian Black Nurses Network, which was founded and is run by Dion Sinclair, who is a member of the Black Opportunity Fund, and a group of nurses in senior executive leadership in Ontario and across Canada. We also have the Ontario Black Nurses Network, which is the professional voice for Black nurses in Ontario. We also have Black Nurses Association of Nova Scotia, which kind of advocate for Black nurses in Nova Scotia. And I have to say there are so many other organizations, but at the time when we came together, these were the organizations that really wanted to work together, and we're expanding. So you have to stay tuned to know more about what we are doing and who we are. In terms of our strengths and what we are doing, I kind of put those in a few words in the next slide. So first, we advance health equity through collaboration. So collaborating with different organizations like the Sickle Cell Disease Association of Canada. And when we share this slide, you're gonna see what the initiative they're doing about blood donation is about, and you can scan this QR code. I'm almost done. There's also this petition on having a national framework for sickle cell disease, which I want everybody to read about when you do have these slides. Then also we advance health equity through research. So this is very, very hard of the press. Just last week, the government, Health Canada, announced funding on health workforce, and we are so delighted to be working with a team of researchers from Athabasca University and across Canada on looking at regulation in relation to internationally educated nurses. And we know that many Black nurses are internationally educated nurses in Canada, so stay tuned. And also we advance health equity through mentorship and sponsorship. I said the other time that we're a collective of organizations. So on this slide are some examples of the initiatives from different organizations who are members. And I will quickly just touch on Black Nurses Leadership Program with the Ontario Black Nurses Network. So they are receiving applications for the fall cohort. So everybody, if you're a nurse in this room or if you have nurses who are interested, please reach out to them. And then, we have our workshops as well, like capacity building is key to it. So I know we are going to still talk, so I will leave this slide. I'll come back. Yes. So this is I really included this slide to kind of talk about it. Like, what does that, capitalizing on strength looks like? So it's just a summary of everything. So thank you so much for the opportunity.
Thank you. Thank you so much, Damilola. And this work is key because I think sometimes when we're talking about Black health, we focus on patient health and we leave out the health professionals. And I think this, again, is a weird Western dichotomy because anybody who's a health professional is also a patient. But at the end of the day, if we want our community to be well, the health professionals who are Black, who are experiencing racism, they can burn out. And so that affects the community anyways. We want more representation, but we also want to keep the people who are there well so that they can be our advocates within the healthcare system. So thank you for your phenomenal work.
Thank you.
We look forward to more during the Q&A. I know some questions have already started coming in. We see you if you're asking questions. We're not going to address them right now because we've got the second half for that, but please continue to ask the questions. We're keeping track and we're going to honor that in just a moment. But last but not least, I told you that, Dr. Omole is a surgeon. She, we wanted to give her a bit of time. So she is now, did I lose her again? There she is. Okay. Dr. Mojola Omole. So thank you, Dr. Omole. And so I will give you the virtual microphone. Please go ahead.
Thank you so much for having me. Sorry I was late. I'm also in my car. I'm not driving. I just pulled over. So if you hear sounds around me, it's just all the cars that are around me. So thank you very much for having me here today. Thank you for introducing me, Anya, and thank you to the Black Opportunity Fund for this opportunity. So I want to just talk about BPAO, the Black Physician Association of Ontario, which I'm the current...
Dr. Omole, no, we can hear you. I'm just wondering if you don't have slides, then we want to amplify you so that they can see you really well.
I don't have slides.
Okay, so then we're gonna pin you and make sure folks can see you. Okay, please go ahead.
Yeah, so I can make slides. So I just wanted to talk about the Black Physicians Association of Ontario, which I'm the current president of. Dr. Norum has been the past president of it, and actually through her leadership in the years where she was president, has actually really propelled us to be able to do the work now that we're doing, to be able to support our community and also support learners and increase medical learners, Black medical learners in medical training. So, always whenever I talk, I always have to, give thanks and her flowers, because without her leadership, we wouldn't be where we are today. So our focus at BPAO is really focusing on the three pillars that we focus on. Firstly is just increasing the number of Black medical students that are in medical school across Ontario. In Ontario, Black people who identify as Black, represent 4% of the population, but we only represent 2% of people who are actually in medical education. And the projection is to be able to increase that is going to take about close to 20 to 25 years in that time frame. We've been able to collaborate firstly with University of Toronto to start the Black application stream, which really is trying to address the equity aspect of when we talk about DEIA, being able to say, okay, well, the road that you travel to get here is different, and being able to account for that. All these students have exactly the same GPA. They've gone through exactly the same rigorous process of MCATs. It's just looking at the reality that for many of our Black learners, they're coming from households where they don't get to take the summer off to write the MCAT or to do free research. They have to be working. Like I have medical students now who are still working in medical school to help offset the cost of their education. So that's something that, you know, we do a lot of it. And then once they are in medical school, it's a support system. I'm Nigerian by background, and I would say one thing that is common across all Black people in the diaspora is our communal way of learning and supporting each other. And that's something that we really built in BPAO in terms of mentoring medical learners at different stages. And also once you're finished, so you're not just dropped off the cliff the day you finish residency and training, but that you're still having that support system. And so being able to support people in groups, like we call it, like we have little pods, and being able to learn from each other. I think oftentimes the Western version of education really strips away the fact that it's not a competition amongst us, that if I win, you win, if you win, I win, and trying to infuse that back into the way that we help them with mentorship, that really you are your I was gonna say brother and sister, and they and them keeper. Like we are all each other's keepers. And so it's really important that in mentorship that we're not just going, you know, the staff physician to the medical student to the resident, but that it's actually interwoven, that like as a medical student, you can also support each other. And that's something that we really work hard on BPO, and creating different communities for support for the medical learners. Of course, before we can get them there is the high school. I meet so many Black young people who have an interest in medicine, and they just don't know how to get there. So that is one of the of our core tenets that we're working on in the next 2 years, is to have much more of a presence in helping to create curriculums and pathways to get them to university. Once they get to university, the work that has been done by the Community of Support, led by Ike Okafor at University of Toronto, and is all across Ontario now, has been really great in supporting university students to become physicians. But we also need to get into the high school so they see their path, so they're able to kind of say, okay, this is my plan, this is what I need to do to get there, and help them to get there at all the different levels. Another major part of what we do is supporting physicians. And as Dr. Onurum had mentioned, physician wellness is very important. And definitely since the pandemic, many of our Black physicians have been tapped at the different hospitals to lead different initiatives about, you know, Black health. And so it's really important for us to have wellness activities so that we can make sure that we stay healthy, whether it's like financial literacy is really big, that we try to really do a lot of webinars and a lot of sessions on, whether it's entrepreneurship. You know, those are the things that we want to really improve the capacity for our physicians, so they feel like they have different avenues to support themselves and therefore be better practitioners. And then finally, in the community, yet again, from the work that Dr. Norum had did before, we really were able to increase our impact and our presence in the community during the vaccination period. That has continued, that we still are continuing to be there. We have wellness clinics. Last year, we did over 7 wellness clinics throughout Ontario with different Black community health centers in Ottawa, in Durham, Black Creek, and different areas in Toronto. And we're hoping this year to go to London, Ontario, and Ottawa to do some more wellness events. And then we have our Black Health Talks, which, you know, it's either a webinar or in person, where we're bringing physicians to the community, having a topic, and we're able to help educate the community about a certain topic. And that's something that we're looking to continue. And also now that there needs to be an understanding that there's variations in terms of certain health topics when it comes to Black people. Like, for example, I do breast cancer. And so I'm quite passionate about making sure that we have guidelines that really do address the needs of Black people who have breasts when it comes to breast cancer screening. And so we're doing more work in terms of being able to, have position papers and being able to influence policy on that level, as, we do have a prominent role in terms of about Black health. I got a 1 minute warning, so I think I am finished. And if there's anything else, I'll be able to answer it in the Q&A. Thank you very much.
Thank you so much, Dr. Omole. Thank you for the flowers. I'm sending flowers back your way because you're doing a phenomenal job leading the Black Physicians Association of Ontario and really improving healthcare for Black folks, not only in Ontario, but the critical mass of us are in Ontario, but it has a ripple effect really across the country. So thank you for your leadership. I had to jump in and interrupt before people say, like she interrupted everybody else, but she doesn't interrupt the doctor. So yes, I've also interrupted the surgeon, but we appreciate you. Look at you in your car, just, bringing that energy. We appreciate you. We appreciate you. And so yes, I really want to applaud the work that the BPAO has done throughout this whole time, but in particular as we improve the impact that Black physicians are making. And again, similar to the piece with the nurses when we talked about wellness, I think when we talk about advancement of the doctors and advancement of the medical students, sometimes our communities think, oh, once you get to the medicine, you're fine. And, why do you need advancement? But in fact, as we saw during the pandemic, if we don't see our leaders rise to where they're going to be, if they're not well, if they're not given the opportunity to be at the decision-making tables, then we end up with, things that were said at the beginning of the pandemic, like, oh, this is the great equalizer and everybody will be equally affected. We weren't at those tables at the beginning. So it is important to support our Black medical students, to recruit them, but also be pushing for their rise and the rise of leaders like yourself, Dr. Omole, so that we have that impact, right? As we're talking about issues like breast cancer screening and other areas where you as an individual and the BPAO are involved in advocacy. So we've got the discussion section that's about to happen. We're actually running on time, so fantastic. We don't always have to be on time, but it's nice when we are. So we're going to go into first a Mentimeter because we want to hear from the collective. We want to hear from the village. We want to hear from everybody together. And then we're going to go into individual questions. I just want to let the panelists know that there are already a couple of questions in the Q&A. So you can start to think about those as we launch into the Mentimeter. So Chidozie asked, let me get that here for the panelists. How can communities sensitize individuals on seeking mental health? I think Chidozie also asked a question about, could we have summer camps or something to talk about normalizing issues around mental health? Somebody has asked about the slides from Damilola, so I'll leave that to Damilola to maybe answer in the chat. And then what about Black gerontologists? Are we encouraging that specialty? The answer is yes, we are. But we could talk more about that, and maybe Dr. Omole can speak to that, but certainly I'm involved in some work around Afrocentric geriatrics. So yes, the need to help Black seniors is on the agenda, but I just want to flag these questions for the panelists. Any of you who want to answer them, please feel free to answer them when we return from the Mentimeter. But right now we're going to go into the Mentimeter and hear from the village. So we've got 3 questions. What do you folks feel are the current health challenges that we're facing? So the link is in the chat to join Mentimeter, or you can do it through the QR code there. Okay. So we'd like everybody to participate so we can get the answers, because this is being recorded. The community needs to know what some of I mean, we have a sense of what the issues are, but we want the village to write it. We want the village to answer as far as priorities in particular. So we're getting responses. Please come on, click in. We've only got 3 people on the Mentimeter, and there's 48, almost 50 of us on the line. Panelists can participate as well. And so Black racism in healthcare. So I'm thinking it's anti-Black racism, and in the profession for healthcare workers, yes. And the resistance that's happening towards equity, diversity, and inclusion in medicine, yes, the resistance is real. We do see those things historically where there's progress and then there's pushback, but we have to keep pushing. Black maternal health, absolutely. I think many of us are aware of the data in the United States, but we also have data in Canada. Now, chronic disease, yes, unfortunately, all of them, right? The stress of racism has an impact on chronic disease, many chronic diseases for us over time, in particular diabetes and hypertension. We've got lack of access to timely care. Absolutely. And with that, I think we need to think about physical care and mental health care that we were talking about before. Cancer screening. Again, Dr. Omole spoke about this, thinking about breast cancer screening, but it's more than just breast cancer as far as thinking about the screening that needs to happen in our communities to save lives. So breast cancer plus as far as cancer screening, health navigation. Yes, we know that many people are newcomers to the country or have just barriers being able to navigate in our community. We see that with Indigenous communities, sometimes there are hired folks who can work as navigators in the system. Maybe we need something similar at a number of our hospitals. Affordability, speaking to access for health services and professionals. Yes, that came up with the mental health piece. Absolutely. Lack of race-based data. Yes, not only to recognize the problems and the disparities, but where we join together and reimagine a better future, we want the data to know that we had an impact so that we can continue to do great work. Overall health literacy, absolutely. Racial bias and algorithms and AI technology, it's coming. It's coming. It's already being shown to be a problem. We have to be in the arenas when it comes to AI and medicine. Otherwise, we'll be trying to reimagine after that, right? So we can be ahead of it. Lack of preventive interventions, yes, I suppose that means that are culturally affirming for Black people, anti-Black racism, over-reliance on costly allopathic medicine. That can happen as well. We do see that for those who can afford it. Sometimes the lack of trust or the distrust with regular medicine makes people go to allopathic medicine, which can have an impact on their financial health. Anti-Black racism, mental health, lack of cultural understanding by healthcare professionals. Absolutely. And I was wondering about that even with the mental health piece. Yes, we can increase our numbers. Yes, we can come together as a village. But at the end of the day, we're only a small proportion of the healthcare system. Even if our representation is good, we need to make sure that our colleagues are not being violent to Black patients. We need to make sure that non-Black health professionals can serve our communities. Afrocentric approaches of healing not being funded, and Dr. Mullings coming back to that, thinking about those frameworks of how we need to be well, and it's hard to get those approaches funded. Pain management, Black pain is often dismissed or diminished, and we see that particularly with sickle cell disease. Like, where in the world do people experience discrimination based on a genetic condition, the way that sickle cell patients do? We don't see that for cystic fibrosis. We don't see stereotypes where these folks who have genetic conditions come in crisis, except really sickle cell. Longitudinal data, I'm assuming with regards to race-based data and interventions. And again, there's sickle cell, chronic disease management, mental health, HIV. Yes, HIV didn't come out previously, but certainly is a concern in our communities. Okay, thank you for those 31 responses. I think so out of the 48, I want to see more. So people still please do log in, but maybe we go on to the second question. But the village has spoken. Thank you for these responses. Let's go to the second question. All right, I hope you are ready. So what are the priority health challenges within Black communities? And what potential further exists for Black communities? So again, we're saying not just the pathogenesis of what's gone wrong, but the salutogenesis. Where does health exist? So what are some of our potential opportunities in Black communities to improve our health? So please put the challenges and the opportunities as you answer the question. I want to see more and more of you folks registered. Don't forget the link is in the chat. So far, we're at 0. Okay, 1 response. Come on. I know people need time to type. Don't worry, I'll keep talking while you type. Okay, so need to have non-Black healthcare workers to have cultural humility. Yes, yes. And the cultural dexterity to be able to serve Black communities and other communities. That cultural humility is key for them to recognize their biases, their limitations, to be curious, to listen to Black patients, and so that humility is required. That cultural humility is required. Race-based data, we need it. Every time we have it, it lets us know about the challenges that we're facing, and we get a clearer picture. We need more Black-focused leadership. Yes, yes. So that's what we were talking about. We need it in healthcare and beyond. You know, and in EDI positions and beyond, we need to be in all the places to have an impact. Education, especially in areas of mental health. Yes, education for our community and education for health providers so that they're able to provide anti-racist care that is uplifting instead of demoralizing to our communities. Leaning on natural ways of healing. Yes, I think that becomes really important. Even the ways that we gather, the way that we have historically come together in even places of worship, like those actually have quite a bit of evidence. Knowing our history and ancestry actually is shown to be protective. There's a lot of things that our communities do that we don't always think about. Beyond thinking about a naturopathic or natural medicine, there are ways of healing that we have that we take for granted until we get quite sick. Health education and using community pillars of trust. Again, like the churches, to boost health literacy. Absolutely. Peer education programs, we're part of those through Taboo with regards to cancer screening. They make a difference when we use our places of gathering and worship where the village comes together. Afrocentric perspectives on spirituality, religion, addressing anti-Black racism, capitalizing on strengths in our community. And we appreciate Black Opportunity Fund. You know, session 2 was on case examples of Afrocentric care, successful examples, removing barriers to Black healthcare workers. Absolutely. And so, you know, our nursing colleagues are taking leadership on that, and we congratulate them on being able to do that for, particularly I'm thinking about barriers to foreign trained healthcare workers and nurses. Quality care and less misdiagnoses, absolutely. Funding for research specific to Black health. There are so many barriers that we experience there. Okay, so we're at 7:23. We've done 2 questions, and I think now it's time to hear, we've got quite a few questions in the chat. So why don't we go to that? So thank you to the whole collective for answering those questions. Okay, so there was a question, now I've lost it earlier, about, 1 second, I'll pull it up. And I'm hoping one of the panelists wants to take that on. How can the community sensitize individuals on seeking mental health help? How can we? So I don't know if Dairai or Noreen want to speak to that, but anybody can. But Noreen, perfect. And
Yeah.
then Wojola, okay. Dr. Omole, go ahead.
The first thing that comes to my mind is normalizing seeking supports being key. So when we think about It Is Okay campaign, I think what we're doing was normalizing that it's okay for individuals to experience mental health challenges. And how we can do that is to talk about mental health without it feeling like it is taboo or using it as an adjective. Really recognizing that it has an impact, and we all have mental health. So one person's experience can have an impact on all of us, indirectly and directly. And so we can start by normalizing mental health, experiencing mental health, seeking supports the same way that we normalize taking care of our physical health.
Oh my goodness, I love it. We do need to normalize it. And for myself, you know, what I say in our community is like, there are so many things. We are lucky to live in a society where we're like all of our ancestral cousins are all together, we're all together, and we can look at approaches to mental health, whether it's meditation, yoga, therapy, ways of gathering, our own ways, all of the different ways so we can stay well. And I can say as a health provider, I also have a therapist. So we need to normalize that. Now, for that question, thank you. Dr. Omole, I know you had an answer to it, but I just got word from the back room that we had one more question for the Mentimeter. And then I'm going to come to you, Dr. Omole, as far as your piece on that, okay? But we have one more Mentimeter question. I hope you folks haven't logged off your Mentimeter. There's one last question that we had for the village, and then we're going to go back into the Q&A. Okay, so thank you for that, Noreen. And so the last question of the night for the village of the collective is, how can we capitalize on the strengths within the community to improve Black people's health? So not only what are the opportunities, but how can we strategize, capitalize on what exists, on our strengths that we already have, despite the oppression, despite the barriers? What are the things that we need to capitalize on, amplify, strategize? So please do put in your responses. You might have to log in again into the Mentimeter, but please do. We definitely, this is crucial. This is crucial. Please do log in. Okay, answers coming. Continuous education, yes. Again, in our communities and for health professionals, I would say, to keep learning and unlearning and having that awareness of towards, you know, as Dr. Mullings put it, our Black liberation, because we're not going to be well until we know who we are and where we're going. Marketing from our own community about our strengths. Yes, yes. Unfortunately, mainstream media does not amplify the good news. And so we need to do that ourselves by showcasing our excellence unapologetically. Yes, all of that. Workshops and interactive sessions. Yes, absolutely. Nothing about us without us. And I would say with the resources behind it. I'm sure everybody in this room has been pulled into a room where they were like, well, we want to consult a Black person, but you're going to have to do it as like extra time out of your busy day when you're already burnt out. So nothing about us without us, but hopefully some resources behind that is if we're going to be brought in to be a voice on a number of issues. Band together as one community despite our differences. There is strength in numbers. Yes, amen, hallelujah. It's about the village. We must come together and form coalitions. Directory of providers, we do need that. And the health, the Black Health Professional Network has begun that fantastic work. And I think also is working closely with BPAO on that as well. We need funding opportunities for research into cultural and behavioral determinants of health in Black communities. Yes, absolutely. Not being afraid to speak out and advocate. Yes. Now, there is reason to be afraid at times as far as people being either called unprofessional or being you kind of attacked in the room, particularly for Black women being the angry Black woman. But I think it's the piece that was already here, banding together. And so when we speak together, when you find people in your organization to speak as one and allies, then that work can happen, but it doesn't have to happen as one person by themselves. So not being able to speak out and advocate, I would add as a collective as much as possible. And then here we see profile leading Black health leaders, support Black health leaders in our community. Yes, support mentorship and leadership development, share and make our collective values known as far as respect and collectivism. Yes, absolutely. And I see here it's hidden by the QR code, but increased visibility of Black healthcare. I'm sure it's like workers or success. And certainly those of us who are the young folks that are coming up as leaders, like in Dr. Nicolas Cadet, right? Or who's a young leader, not coming up as leader, obviously already a leader. And accountability by institutions, absolutely. That transparency and accountability in how they are treating Black patients or Black lives, how they are unlearning their own racism and their policies, hopefully on race-based data. We want to see that accountability. Okay. We have 13 responses, but they are powerful. And when it comes to capitalizing and strategizing, I think that's a good round number of feedback that we have there. So thank you. I want to make sure we still have quite a bit of time for Q&A. So we'll close the Mentimeter. And because I'm mindful of the time, we would still have a good 20 minutes for discussion. I think discussion is the best part. So that was our last Mentimeter question. While we close that though, Dr. Omole, I know you wanted to speak on the question around mental health. Please go ahead.
What I was going to say was similar to what you guys said, was just normalizing it. And for me, I find the importance is to normalize that I also have mental health issues. So with my patients, like, people always think it's weird that a surgeon talks about it, but oftentimes when you ask people questions, things come out. And always just talking in a way that's like, yes, I have depression and anxiety. I take medication. I have a therapist. And I do think by doing those type of things, people see it no longer as like, oh, only quote unquote crazy people need those things. It's just like normal functioning people. That's how we normally function, is by seeking the support and seeking help when we need it.
Thank you for that, Dr. Omole. And that's it. We have to destigmatize. And those of us who are leaders, we need to not think of it as weakness or stigma ourselves. We have to role model that. So thank you for doing that. And sometimes it's not easy. So I appreciate you mentioning that as well. That's part of the destigmatization. We need to walk our talk. Okay, so Q&A, let me jump back in here. The community sensitized individuals. An anonymous attendee asked about what about Black gerontologists? And so when it comes to geriatrics in our community, you know, we've got great folks like Dr. Mireille Norris, Dr. Anita Brown-Johnson. We've got the young folks coming up like Dr. Jamal, what is Jamal's last name now? I can't remember, but a very young Black gerontologist who's fantastic. So Jamal is fantastic, but Dr. Omole, I don't know if you have anything to add on that. And for our nurses group, I mean, working with our seniors requires a whole team, so not just the doctors. So I'll turn to Dr. Omole, but I'm happy to hear from any of our team to speak about the need to care for our seniors, our elders. Dr. Omole?
I would say the part that I was just going to add is that in October, BPA is having our first women's health conference, CPD. And one of the areas that we are focusing on is looking at particularly women in this group, but looking at, you know, dementia and looking at depression and the overlap of that as you're getting older, and how oftentimes, like mental health, when we talk about young people, even older people is also under-recognized and undertreated. So I do think that that's something that, you know, we're trying to be more cognizant of, is that oftentimes we talk about the young people, but then as people get older, we forget that there's still health concerns that they have.
Absolutely. Thank you. And so I'm doing work with Dr. Notisha Massaquoi and Dr. Mireille Norris, looking at young folks who are looking to get into medical school. So pre-medical students getting their kind of clinical experience, but by volunteering in a nursing home or in a home with our elders who have dementia, to spend time with them, a thing called friendly visits. So there's ways to kind of encourage those who are coming up into our fields to also spend time with our elders as a full circle. So I see Damilola has her hand raised. Please go ahead.
Yeah, thank you. And just wanted to add that we're now having more research on dementia, especially in the Black community in Canada, which is wonderful. And I know for sure Dr. Ingrid Waldron, which I know maybe some people know in this room, she's leading a research on the experiences of family caregivers around dementia. And the GTA, she's in Hamilton at the moment. And in Nova Scotia, the Health Association of African Canadians, which were part of the last town hall, they've had series of initiatives around educating the community around the risk factors for dementia. So it's growing, and we have some nurses. So I do know like some nurse faculties across Canada who are interested in that area of work, and they've been doing some research. So hopefully in the next 5 years, we have more information for sure.
Yes, thank you for that. And that's fantastic. We need to kind of say the names, say the organizations doing this work. And I think there's an ecosystem building around this because we recognize that it's an urgent issue, and that intersectionality that Dr. Omole talked about. So not only does dementia affect, of course, Black women, but also probably Black women disproportionately are caregivers, particularly at an older age themselves, dealing with a partner who might have dementia. So both, right? And thinking about the village. I also need to give a shout out to Ngozi Ironye, who is the EDI lead for the association, for the Alzheimer's Society of Ontario, and her work in this area as well. Noreen, I see your hand is raised.
Yeah, I was going to mention that maybe this is speaking to the nature of therapy and its groundedness in Western medicine, that we do see less and less seniors coming to therapy. However, we know they are accessing supports from the natural supports that they have, and those can look like each other. They can be friends on a bench, they could be going for coffee, whatever that looks like. So we're currently looking at how to support seniors to support each other, and bringing that up as another way to lead to the therapy if it's needed, instead of just assuming that they're going to come. I will also give credit to the Africa Center in Edmonton that has a program where the seniors get to interact with the daycare program as a way of bringing those two generations together, right? And through that, we get to have some really interesting conversations with the seniors about what they want to see the next generation carrying forward, whether it's culture, what they need to know about taking care of themselves, and sharing that resiliency through that intergenerational conversation. So I think maybe it does not look like they're coming to therapy, but they're taking care of themselves in different ways. And those are the natural ways that we also need to amplify as well.
I love it. And that is the thing, right? Where we talk about our ways of healing, that is healing, where you have our elders with our young folks, and it's a bilateral support that happens there. So that's a beautiful thing. Thank you for sharing that. Damilola, you already spoke. Is that a legacy hand, or you had something you wanted to add?
Just quickly, just a quick plug in for a research that is actually currently running in the GTA. So I'm connected with folks from LAMP CHC, Roots Community Services, and Delta. So they're looking at the experiences of unpaid Black women who are caregivers, and the impact of being a caregiver on their mental health. So just wanted to put that plug in, because we're talking about, caregivers, mental health, and all that. And I can share that information with the Black Opportunity Fund team later. Thank you.
Thank you. Yes, we can send that out. The next question, I'm going to call on Dr. Nicolas Cadet, and I heard that there's a hand raised from the president of the Quebec Black Medical Association, Dr. Edouard Kouassi. So we're going to go to you, Nicolas. One of the questions is about language barriers within Black community. And c'est le français peut-être, but also there's a bigger piece probably that you see in Montreal because of people coming from so many diverse communities. So it goes beyond the English-French dichotomy. So if you can speak about language barriers within Black communities, and then we'll go to Dr. Kouassi, who raised his hand. So we'll spend some time in Quebec. Okay, Dr. Cadet?
Yeah, sure, absolutely. So we do see quite a bit of that playing out in Montreal, because there's people from all over the world, really, and so we have people, and oftentimes the thing is that in healthcare, it's already a little bit complex, because I would say part of the healthcare system, a big part in Quebec, is mostly Francophone speaking. So mostly French speaking, but there's also the Anglophone part, and within all that, it's as if most people expect patients to speak either one of these. But I get a sense that sometimes I feel that we're kind of left behind, for us being of African descent, because let's say if there's someone who speaks Mandarin Chinese or Vietnamese, they're going to call an interpreter. But oftentimes when it's people from our community who speak, like our native languages, oftentimes people won't necessarily think of calling an interpreter. It's as if they're going to say, oh, well, you come from, let's say, the French or English Caribbean, well, you must speak some French or English. You see what I mean? So I think there's probably a blind spot there. And I think that the healthcare delivery is for sure suboptimal, in those contexts. If you don't understand your patient, how are you going to provide good care? So that's one thing I would say about that.
Yes, thank you. And I think it is an issue being able to access interpretation. And I think because probably unlike the two other large visible minority groups, so that's Chinese and South Asian, so visible minority, I'm using the Statistics Canada whatever categories that they use. But the Black population, 43% of us are Canadian born. So I think people think that it's less, language is less of an issue for us. But I think where we talk about intersectionality, if people are not fluent in English and French and being Black, as you said, it's like a double jeopardy on top of that. So thank you for mentioning that. With that, like I said, we're going to spend some time dancing in the Quebec environment. So we've got Dr. Edouard Kouassi. So Dr. Edouard Kouassi, I don't know how to unmute you. I'm going to hope Nia can do that for us, but we see your hand raised and we'd like to hear from you as far as your question and comments.
Be allowed to speak now. Oh, perfect.
Can you hear me?
Oui, on t'entend. Vas-y, go ahead.
Very good. So sorry, in fact, it was a mistake. I'm not raising my hand, but thank you for giving me the opportunity to say a word. Congratulations for the discussion. I think this is a very great event for BOF and for all our Black communities. So I don't want to take more time. Congratulations for the discussion. Of course, I share the opinions of many people who already talked about very important issues in terms of Black health in Canada. So thank you again and congratulations.
Thank you. Et félicitations pour ton travail aussi, for your work with the Quebec Black Medical Association and the advancements and accomplishments that you had with youth also at Université de Montréal. So we recognize and celebrate you too.
Merci beaucoup.
Mon plaisir, mon plaisir. Thank you. Okay, so I'm going to go back to the Q&A. We have from James Mohato, from the perspective of affordability, as healthcare professionals, what's a leading factor that restricts access to health services based on costs? Ooh, that's a heavy question because there's so many, although we have universal healthcare, when people need medications, when people need mental health care, when people need physiotherapy, it gets quite, or when people are for prolonged periods in the hospital for treatment, need to be discharged for cancer treatment. There are so many areas where it creates vulnerability. So I open it up to all of you if you have some thoughts on areas that you either are seeing through your organization that you're advocating on or have been asked to advocate on, or perhaps that you've just noticed with your patients anecdotally, either one. So please, whomever, just go ahead and unmute. And that piece about affordability is certainly a barrier.
On our end, I think it's the lack of knowledge of benefits that individuals actually have. So employees have EAP programs. So there's an employment assistance program where individuals can access mental health supports, including your benefits package. It's not just dentistry, it's not glasses. It usually does include mental health, and those go underutilized. So that's where a lot of the funds are being missed in terms of where people could probably have that cost covered. And I can also see it again, bringing in families into the conversation. With children family services, that stigma again, because you need to be part of that system to access different services. Individuals don't access that, therefore no longer having access to those supports as well.
Hey, thank you. And that actually brings up the issue of navigation, which came up in the when the village spoke in the Mentimeter. Sometimes there are resources available, and we don't know because we don't have the resources or the social capital to even know about them. Dairai?
Just to add on what Noreen shared, it's also important to understand that there are a lot more people that are in jobs that have taken away salaries and benefits. So you're working on an hourly wage and you have to either make do without benefits or you have to pay out of pocket for benefits. So we have people within that system too, economically, that just do not have and are working 2-3 jobs sometimes just to keep a roof over their head and food on the table, and do not have access to this. And depending again on which organizations that you work for, some organizations will give you access to perhaps $450 per year that is supposed to go towards your mental your counseling or therapy, but they don't just assign it to counseling and therapy. Then it's put and clamped together with, is it massage therapy as well as anything else that you might want to do. So when you use up the $450, then you're done. And when you're looking at therapy, most services that you're looking at now with the cost of living, you'd be really, really good if you can get something that is less than $150 an hour. So ultimately, they're saying you can actually access services for 3 hours, and that is supposed to take care of you. So there's so many nuances that are attached to this, and I believe that we need to also just be aware of the fact that not everybody is working a job that allows them access to benefits.
Yes, no, that is definitely true. And so yeah, so not having benefits, but also having insufficient benefits. Sometimes it's almost a joke because you do have to spend time sometimes with therapists to realize if there's a good therapeutic relationship, and then your benefits are over. Damilola, I think yes, go ahead.
Yeah, just to add to that, I think the onus is on us as healthcare professionals to educate our community about these benefits as well. Yes, yes, we can have navigators, but if we don't educate our members in a way that makes sense to them, they probably will not access that care, right? So yeah, just wanted to throw that out.
Yeah, that community education piece and awareness. I'm big on the power of social media, and that helps to reach folks as well. Dr. Omole wants to add a piece, and I haven't heard from Dr. Mullings, but the next question on cultural sensitivity and awareness around non-Black healthcare providers, I'm going to turn to you because we're going to conclude soon. Dr. Omole, before I go on, also, if somebody wants to put in the chat, either Dairai or Noreen, there's a question around a list of Black therapists across Canada, if you have an opinion on that. But Dr. Omole, I'll go to you. And then Dr. Mullings, I'm going to go to you around the question around awareness around Black health for non-Black providers. But I'm also going to ask you about Black providers. We're going to go there. Okay, so hang in. But I want to hear from Dr. Omole. Please go ahead.
Oh, I was just going to add that when you're even talking about affordability, it's just even to afford the time to go to the doctor, right? It's like, it's as simple as, for some, if you work an hourly job, to go to see a doctor takes sometimes 3 hours. So that's that's half of your day that you don't get paid for. And so I think that, the structure of how we have labor in this country is very problematic in terms of having to actually be able to seek health and to be healthy. And so that was just my thing when talking about affordability. It's like, you just first have to even get there. And that in itself is a barrier, depending on the type of work you do.
Yes, absolutely. Thank you for that, Dr. Omole. And then, because people think it's universal and it's free healthcare, but there's so many barriers when we're thinking about our communities. Now, the final question that we're going to have, and then we'll conclude because we're looking at the time, but I find this question very interesting from the perspective, so thinking about cultural sensitivity and awareness. But when it comes to awareness, there's a need to educate non-Black healthcare providers so as not to burden Black healthcare providers with teaching on Black health. But I also wonder if your work has also looked at us as Black healthcare providers and our ability to kind of have the frameworks and the unlearning of the colonization. Sometimes we are also perpetuators of colonial thinking. So I wonder about that and how we can reimagine that for our allies and for ourselves, Dolores. So I give this last question to you.
Yeah, I'll
Dr. Mullings, excuse me.
That's okay. You can. Dolores is fine too. Thank you for that question. It's really important, the piece around how those of us that are Black identified shift out of this the legacy of colonialism, where we've been educated in the colonial system with the colonial texts and whoever stands in front of the classroom. And so it's difficult for us to all of a sudden say, oh, no, we're not going to do it this way or that way, or we need to do it this way, because we've been indoctrinated now. And you know, as physicians, as I know as a social worker, we've been indoctrinated a particular kind of way to behave a certain kind of way. And if we do not behave that way, we're not seen as good doctors or good social workers, or that can be problematic. So how do we bridge that divide between the Afrocentric point of view, perspective, the needs of our peoples, and staying centered in whatever it is we need to do inside, as Audre Lorde would say, the master's house, so that we can use their tools to change what we need to change. So there's that piece. And then the other piece is mass education, but not every once in a while. In med school, social work school, like in grade school before people start, I'm talking about systemic change in such a way that is embedded so that it can't be just fluffed off, or people feel good that they're, oh, I'm doing some EDI or DEI or anti-Black racism training next year for 2 hours, and then nothing happens, because actually that doesn't do anything. So I think the both pieces it's important that the both pieces are there, but we can definitely be the driver of that change by providing the leadership about what the education needs to look like and from what place we start.
Thank you. That is it. When we're thinking about the colonial structures we're in, how do we decolonize ourselves and contribute to change? And then with that, also empower our allies to do that deep unlearning that they need to do to be able to, so that we can help and save Black lives. We've got, I think Damilola wanted to say one quick thing, because it's 7:51 and we're going to conclude. Okay.
Yeah, I totally agree with what Dr. Mullins said, and wanted to add that we cannot continue to talk about cultural sensitivity, cultural competence and awareness in the context of the person, right? So we have to shift that language to also take into consideration the social context and the structures in which those exist, because until we do that, we'll still continue to perpetuate, the need to focus on individuals as being problematic and the people needing to do the work. So,
absolutely. Yeah. Yes, we need to look at the full system, right? So thank you for that. So now we're going to conclude, but I want, or I think Dr. Salami or Dr. Seiki Otu will be concluding, but I just want to say for myself, this was fantastic. It was such an honor to be in this space with you folks. It's going to be recorded. I hope it has a ripple effect, and we have to continue this reimagining. And change is happening. And so it is a beautiful thing. Yes, there's a resistance, but we also know how to resist collectively and have that non-toxic collective resilience. So together we are stronger and together further. So with that, I congratulate you, and I appreciate you, and I appreciate the Black Opportunity Fund for asking me to moderate this. And now I'll hand over the virtual microphone for final remarks to Dr. Bukola Salami.
Thank you so much, Dr. Nromo, for the wonderful moderation. We were on time. This time, I think the last time we were a bit late. And thank you so much to the panel members, and also to all the attendees. It's been a great pleasure listening to the wonderful conversation. And I myself, I learned something new today from Dr. Dolores Mullins about toxic, is it toxic resilience and resisting that? And I think we've all learned about, some of the strengths within our community, and, the potential that an Afrocentric perspective can be able to provide in terms of improving our well-being. So thank you so much for that. We've also gathered some of your insights from the Mentimeter that we will integrate. The next step to this is we will be having our 4th of 4 series in Montreal, and we will be collating the information we got from the first session, which was on the priorities, health priorities within Black communities. The second session was about what Black health organizations we are doing, and this session is more about what are the strengths within the communities, including of Black health professionals within the community. We'll be collating that together to feed into our final session, which will be more of, okay, now what, how do we lay the groundwork in terms of a Black health strategy? That will be happening at the Michael John Foundation Health Summit in Montreal. So we'll have a 1.5-hour session where we'll be discussing. So please, if you're in Montreal or you're planning to be there, please do join us. We have some wonderful speakers, including Dr. Kwame McKenzie and several other people that will be speaking at the session. And the plan now is for us to actually lay a groundwork, co-develop with communities to inform the development of a national Black health strategy. I would also, so I want to thank everyone. I also want to say that we will be having an evaluation, so please check your mailboxes. We'll be having a post-event evaluation, so please complete it, and we welcome you to engage and collaborate with us on our next steps.
Thank you. I believe this is good night. Thank you all.
Thank you. Good
Thanks,
night.
everybody.
And everybody.
Thanks. Have a good night.
Bye. Thank you.
Thanks, Dr. O. Thanks, all the panelists.
Thanks, everyone.
Great. We're
you.
so tired.